In his book, In an Unspoken Voice, Peter Levine outlines the steps required to heal depression. Number one is to become aware that your nervous system is shut down and to know that this is not your fault. Number two is to gently guide your nervous system to shift gears, to lift the dorsal brake. Number three is to be aware that when you do that, the underlying energy of the sympathetic stress response will show up, either as anger or anxiety. So when you are recovering from depression, you may notice anger and anxiety both entering the picture. And many people transition between depression and anxiety, almost like a boat that's going out of the water, under the water, over the water, under the water. And you may think, oh no, I came in here with one problem and now I have two. But please know that this is a sign of healing. We need to expect that sympathetic energy is going to show up and to welcome it. So step number 4 is to look for healthy ways to release that intense energy of fight and flight. It lets you know just how much life force you have available to you. We're going to spend the rest of the time today looking at some specific tools that invite the nervous system to shift out of shutdown. And as we do so, let's take a moment to look at this beautiful graphic by John Hain. John Hain is an artist whose work is available on pixabay.com. So much of his work is really applicable to the work that I do. So I just wanted to give him a shout out here. The words that are drawn into the hands on the outside of this graphic, it summarizes so well the type of presence that helps people to come out of shutdown. Being curious, grounded, patient, calm, accepting, friendly, welcoming, observant, empathetic, inviting, and attentive. These are the behaviors and attitudes that create a safe container for working with depression. And whether you're a therapist or a person living with depression, this is the environment that will be most effective at inviting and creating healthy change. The first tool is, unsurprisingly, to start where you are. And that involves being able to recognize shutdown when it's showing up. It appears a little differently to each of us. But what I'd invite you to do is to look for the pattern, the behaviors, the feelings, the sensations, the language that shows up when you are in shutdown. I have heard a lot of different ways of describing this from my clients over 20 years, and just some examples would be someone saying, I feel frozen. I go away. All I can feel is heaviness. I'm really tired. I don't care. There's nothing inside me. It's all dark. Rather than arguing with any of this language, it's really important that we identify it and say, I'm dealing with shutdown right now. You need to develop a code, whether it's a code between you or a code between you and your helper, that lets you and the people that are helping you in that moment know that you are in shutdown. If you're a therapist, you can notice and share what you're observing as a way to bring attention to shutdown when you see or feel it happening in the room. Some ways of doing this might be to say, I noticed that you're a lot more still as we discuss this, or that your skin has gotten a little paler since we began to work on this. What are you noticing right now? The signs really vary according to the purpose and according to the person, so it's important to learn what those particular signs are for each individual. The second thing we can do, and this is no surprise given what we've talked about already, is to make that safe connection. Being, open-hearted and non-judgmental and warm and friendly and interested. It allows the nervous system to consider moving into a safer zone, right? Moving out of that immobilization and into more of a fluid way of being. If you're a person living with depression, it's really important to treat yourself in this fundamentally kind way. Gabor Mate says, safety is when we feel connection and there is an absence of danger. We need both to feel safe. So in other words, it's harder to feel safe on our own for many people. For others, it's easier to feel safe on their own, although animals are an exception in those cases. I've known many people who their dog or their cat is their best friend and is their best antidepressant because there's, again, this feeling of a safe connection. It brings up that ventral vagal social engagement system. I'd just like you to take a moment and imagine yourself as a big lighthouse of safety, that you're just beaming safety out to those around you. And now I'd like you to imagine receiving that kind of beam. If there's somebody nearby who is just beaming out safety. And just to notice, do your hackles go down a little bit? Do your muscles relax a little bit? Is it a little bit easier to think? There's definitely a connection between safety and warmth. So I'd like to talk about warmth for a moment. Deb Dana is a very skilled therapist who works with the polyvagal theory in her treatment room. And she talks about the connection between literal and social warmth. That when a person feels less socially connected and approved of, they may actually feel physically cold as well. And they may end up wearing extra warm layers of clothing or blankets. This idea that physical warmth can help to mitigate social rejection or social separateness is really interesting when we think about making a connection with people. When someone tells us that they're cold, offering them a blanket or a hot water bottle might be helping more than just their comfort. The same holds true for offering it to ourselves. Giving yourself a blanket or using a heating pad may be deeply effective if you're going through a difficult time when you don't have someone to lean on. There's recent research where patients with depression were treated with infrared whole body heating, and the antidepressant effects were significant and long-lasting. Consider this when you give a hot water bottle, a blanket, or a heating pad to someone who's feeling chilled.